So you've helped people get off of the CPAP, and you make these custom-made appliances that help with sleep apnea and snoring.
Yes.
Tell me about that.
So you'd be surprised, Randy, how many patients actually have sleep apnea that are walking around that aren't even using their CPAP machine. You know, they said 1 in 5 Americans have some sort of sleep apnea or sleep disordered breathing, and less than 50% of those people are actually compliant in using their machine. And so we actually make them appliances that help improve their breathing and keep them safe.
So these people, they're breathing fine all day, walking around, but then they lay down at night, and what's happening? Their tongue drops back, their jaw drops back, blocks the airway.
All of their muscles get relaxed, and it actually starts to compromise the airway. That's actually the snoring sound that you're hearing, is the air struggling to get through the passageway. And sometimes, your wife or your husband will hear you snore, and sometimes, their wife or spouse is sleeping in the other room because it's so loud, truthfully. But, it's so hard to...
So with an appliance, you open up the way their teeth, like pull the lower teeth forward, and they can breathe again.
So we actually make an appliance that helps stabilize and pulls the jaw just a little bit forward, so when they're sleeping, that the airway stays open.
Now what about a sleep test?
So in the past, you had to go to the center, and it's kind of awkward. You have somebody staring at you, expecting you to sleep with all these wires on your face. Now we have an at-home sleep test that's very easy to use, and we get the results within 24 hours. But truthfully, Randy, a lot of the patients that we help are ones who have been diagnosed 5 years ago or 10 years ago and were never compliant with wearing the machine. So those are the patients that we're able to help the most. Now these people, they think they're sleeping, but the sleep test shows that they're waking 10, 20, 30, 40 times every hour, and they're never achieving the REM sleeping. Now we know that the REM...
So they wake up tired.
They wake up tired. They think that that's normal, but when we make them appliance, they're able to sleep better, breathe better, and they're really... They say they feel like a teenager again, that they couldn't believe that they feel that really wonderful.
Now, the spouse. Let's say more men snore than women, or have sleep apnea than women.
So the truth is that the historical opinion of what the sleep apnea patient is a middle-aged, overweight man. Now we know it's children, petite females, young athletes, because there's a lot of things that's in their mouth that makes them at higher risk for this. If they have a small mouth, large tonsils, crooked teeth, all of these things make them very high risk. And, the face of the sleep apnea patient is everywhere. It's 1 in 5 Americans.
So when you get them back sleeping, energy improves. Well, it's like, everybody knows what it's like not to sleep. And when you don't sleep, the next day you're hungrier, you're edgy, you're not in a good mood. So have you seen those things go away? Like you make a custom-made appliance, they're back to sleep.
So a lot of my patients don't even know to ask for this treatment or don't even realize what a positive impact it'll make on their life. When they come in for their follow-up, all they want to do is hug me and hug my assistant because they're saying, they're not napping during the day, they're eating less because they're not getting those cravings from being tired all the time. They're getting along better with their spouse or friends. They're doing better at work because they have more energy. They feel like a teenager.
Okay, so if you've been told by your partner you're a loud snorer, and especially if you know you have sleep apnea, look for a dentist that knows how to treat sleep apnea.
Yes, I'd love to see him.